Okay. Nick, this is Dr. Jameson, and I'm here with Nick, and we're so glad to have you here. Thanks, Nick, for joining us.
Absolute pleasure.
So thank you, Nick. And we're here to talk a little bit about stem cells, or otherwise known as concentrated bone marrow. And what we're going to do is talk about your experience, because you've not recently, a few years ago, you had this treatment in two areas. Where were they?
My left shoulder and my left knee.
Okay, so what was going on with your left shoulder? What could you not do? What was going on? Where was your pain level?
I was living in about an average pain of 6 to 7 throughout the day. But the worst time was when I went to sleep, tried to go to sleep, lie down in bed. It was aching to the extent that I lost my sleep for months on end. Saw a physician and a shoulder specialist, and he said basically I had a couple of options, one of which was live with it. The other one was maybe consider a reverse shoulder replacement, which he didn't recommend because it would have meant moving my shoulder up to 90 degrees, and it affected greatly it would have affected greatly my lifestyle.
So what did it interfere with? What did you normally do that you then at that time could not do?
I'm an ex-athlete, so I always work out. I love exercising. I also travel extensively because of my work. I'd reached a stage that I could no longer use my left arm to put a light backpack on the overhead compartment in an airplane. If I carried something, I couldn't move it at all, and it ached after I let the suitcase down or the bag down. I could do no weights using it whatsoever.
Give me an example of how your arm would go. How much could your arm lift back at that time? As far as motion,
I could go to about 90 degrees, and then it really started aching.
Yeah.
Now goes all the way up, 1,000%.
That's great. Okay, so at this point, now that you're at the full extent of what we can expect a stem cell procedure to do for you, and would you say that you're 80% better, 90%, 100% better? Where would you say you are?
When it comes to range of motion, I would say I'm 100% where I was before the pain was onset. When it comes to pain level, I would say I'm at about 95%, 90 to 95%. Most of the time, 100%. But, with age, there is the natural progression of...
You're going to have some aches and pains.
Exactly.
Right.
So I could not be better than where I am today.
Fantastic. So give us an example of what you can do again. Show me what you can do.
I lift weights normally, and I can do that with
can you swing it behind your back?
Oh, totally, yes.
Yeah, okay.
Totally.
So very good. And so your range of motion is back to normal. Your pain level's near zero.
Correct.
And you're doing really well. And we are a couple of years since the procedure.
About a little over 3.
So at this point, you're saying that from the time we did the procedure to now is over 3 years, and you're still having near 100% recovery.
There's been no regression at this stage yet whatsoever. So yeah, no, and I'm active. I work out almost daily. I cycle. I ride motorcycles. I'm 100% active.
So your lifestyle has not been hampered by this at all.
It's actually better than it was when I was okay, rather than and didn't think something was too wrong.
Yep.
That makes sense.
Yes.
It's actually much better today.
Okay, so now that we've talked about how your shoulder was and how it is now, tell us a little bit about the procedure itself to extract the stem cells from your hip, and the actual procedure of getting it into your shoulder, and how did that go for you?
Sure. So You described fully to me exactly what would happen. You locally anesthetized the area. I must say, I'm not the kind of person that likes taking painkillers. I don't like popping pills to feel better with pain, etc. So when I say there was no pain, there really was no pain. You walked me through every stage as you were doing it. I was laying on my stomach. You believe you cleared the area. You anesthetized it with lidocaine, if I remember well. And then you used a special needle with a special technique to remove the bone marrow. The whole process took, with the preparation and everything, maybe something around 5 minutes, because we did both shoulder and knee on the same day, and then the other side maybe took another 5 minutes. What was weird was when you were extracting the bone marrow, it kind of felt like a vacuuming effect, which was strange, but not painful. But it did feel strange. But you had warned me about that. You had prepared me for that. And again, it really wasn't painful.
It just feels weird.
It feels weird. The next day, I felt like nothing had happened. It was really beyond my expectations on both sides, because I had bone marrow extracted from both sides, and I did expect naturally
to have some discomfort after that.
But I didn't, and I wasn't even on any painkillers or anything, nothing.
Fantastic. So let's talk a little bit now about your knee. Okay, so your left knee was the knee of concern.
Correct.
Tell me what you experienced with pain and how much your motion was impaired, things like that. What could you do? What could you not do?
What I started noticing with my knee was when I was riding my motorcycle for close to an hour, it would start aching. And I'd have to start trying to stretch the knee as I'm riding the motorcycle. And I love touring. I love distance touring. So I would go on, 6-7 hour rides in a day, and normally it wouldn't bother me. Now the knee starts bothering me.
How long would it take?
About 50 minutes, 40 minutes for it to start aching, and then I'd start dancing on the motorcycle with the left leg, trying to stretch it out, bring it back. It would ease a bit, then it would hurt again, then I'd have to stretch it again, etc.
And how about when you were trying to exercise? What were you able to do? What could you not do?
I love to cycle, like I've mentioned, and I had noticed that when I tried to cycle with the left leg, both on a stationary bicycle, but also on my bicycles in the road, going uphill or putting pressure on it was impossible. So I'd reached a stage that I couldn't do one of my favorite exercises, cycling. And other exercises I like to do, which is even just very light squats with a TRX, or with a light weight, just to do some squats for range of motion and strengthening. It was absolutely impossible to do them. So I reached a stage where I was told I needed my knee to be scoped. We did an MRI. We knew that I had osteophytes. We knew that I had degenerative,
which are bone spurs,
etc.
Yep.
And again, I was recommended a short procedure, a surgical procedure. The issue would have been, though, I would have to be in crutches for 2 weeks plus. Then there was a whole rehabilitation process. My knee was going to be twice the size, etc., etc. And the actual physician, again, a different physician than the physician that looked initially at my shoulder, said, why don't you think of just doing a stem cell injection and seeing how it goes?
Because you're not out anything if it doesn't work.
Exactly. So when I came and saw you about this, and you looked at my MRIs, and you had said that you had reasons to believe that this has a very good chance to work. So we did it. It took about a couple of months until I could start seeing the benefits. And it probably took At about 2 months, I could likely start cycling again, exercising gently, etc., doing things that I couldn't do before at all. And it probably at around 4 months, I was better than ever remembering before.
And yet you still had no downtime, so you were still able to do whatever you were otherwise doing at that time.
Exactly.
It wasn't like you had to spend a lot of time in bed or recovering from the procedure, correct?
None at all. The only thing I did was waited a couple of weeks, which you had recommended, and then I started doing some very light physical therapy, strengthening the muscles, exercising the same as I did with my shoulder, and it came back pretty quickly.
And here we are 3 years later. How is your knee now?
Amazing. Better than my right knee that we haven't injected.
Oh, we'll have to sign you up.
When the time comes, believe me, I'm ready.
Okay. You know, I am thrilled that you've had such a wonderful response. And I have to say, as a provider of doing this, your result is not abnormal. You're very right in line with other people. And I'm telling people that they're going to get between 3 and 5 years of response from this, that they'll be feeling, I can't say as good as new because no one ever is, but I think that most people have at least 3 to 5 years of improvement. And the nice thing is we can do this again if we need to.
Absolutely.
So,
and thank you so much for taking such great care of me. It's
my pleasure.
Really been life-changing. It really has been life-changing.
Thank you for taking the time with us today. And this was awesome. I appreciate so much your information. And I'm hoping that other people that see and hear this will have an opportunity to see how your experience can be their experience.
And I'm always available to speak to anybody that may want to talk to someone that has had a couple of procedures done. And till today, I'm feeling amazing. And I have no reason to feel that this is not going to continue for more years to come.
It sure seems like you're doing well. All right, Nick, thank you very much. Great job.
So much.